Zimbabwe's deepening economic crisis has had a ripple effect on almost all aspects of life in the country. A shortage of the most basic commodities has forced Zimbabweans into survival mode. The humanitarian situation is deteriorating even in urban areas, with shortages of clean drinkable water on the rise. Townships, towns and cities sometimes go weeks without running water due to low dam levels in the country. The current drought is also making matters worse. While the onset of the rainy season would come as a welcome relief, it also comes with its challenges.
When water is not available, it's affecting hygiene and sanitation. So we know that open defecation in urban areas has increased because people don't have the water to flush the toilet at the moment. So better go in the bush is what people are thinking than to have have that mess in their own toilet. But this is a public health threat for everyone. So we need to be prepared for the possibility of more cholera and typhoid. I think so the first thing is that we really up our preparedness levels.
Calls have been made for government to scale up efforts to address sanitation problems in both rural and urban areas. 34% of rural population have access to basic sanitation, whilst urban areas are at 43%. A UNICEF report estimates that more than a quarter of the country's population does not have access to ablution facilities. Health officials have warned that poor sanitation is worsening the threat and heightening the risk of communicable diseases.
We need to dispose of our wastes in facilities that are prescribed and that are standard. So it's a very big task. And the clean water, we can have clean water, but as long as we dispose of our feces in the bush, it's the same thing, because the water will seep into the water source, into the water sources that are clean. So we want to we envisage a situation where we move the whole sector in front or forward at the same time. There should be a balance in the provision of water sources and sanitation, so that we reduce the burden that we are going through as ministry. Every time we are planning for disasters, outbreaks, but we could reduce this and progress.
The Zimbabwean government has only allocated 17% of its budget for health, water and sanitation in its next financial year, a figure critics feel is below par for such a critical sector. The finance minister admits the funding allocation is not adequate to deal with the pressure facing the health sector.
A budget of almost $7 billion is quite a bit. I think you'll agree with me, but it's ongoing. It will take a few years for us to get to a level where we feel that it's offering the good quality health services to everyone who needs health service.
Civic groups have over the years criticized the Zimbabwean government for failing to fulfill its constitutional obligations of providing its citizens to access to water and sanitation. Noma Polani, SABC News.